Welcome and thanks for joining us. My guest today is Dr. Rhonda Randall, the Executive Vice President and Chief Medical Officer at UnitedHealthcare Employer and Individual. Dr. Randall, good to have you with us.
Thank you for having me.
And our topic today is mental health and the state of mental health and mental health care delivery in the United States. And I guess I'd like to ask you to maybe tell us about the current state of mental health. Maybe one of the good things is that acceptance of the idea that mental health is actually needed by lots of people is on the rise, and that must be a good thing.
It is. And my background is in primary care. I'm a family physician. So, see how mental health affects our lives at all stages. And you're absolutely right. Over my career, I have seen the stigma surrounding mental health care improve, but I'll say it still continues to persist, particularly in certain pockets. And, we see that people delay seeking treatment often due to concerns about being treated differently or concerns with stigma. At the same time, I think, we're also seeing a little bit of the worried well because there's more conversation with youth around mental health seeking care. And, all of that really leads to needing support how to navigate the healthcare system and behavioral health supports. That crisis that we're faced with now started well before the pandemic, but we know that the pandemic exacerbated what we were seeing prior to that. And the reports are consistent and clear, especially for women, for adolescents, for seniors, for multiracial adults, for people with disabilities, that there are high rates of poor mental health.
And I guess the question comes up, how does one know if one has poor mental health? I mean, some people seek help, others may not know they need it. So how can we get the word out, hey, if you're having this or this type of situation, maybe you should seek mental health treatment?
Yeah, and mental health is a broad term, behavioral health, right? It can include things as um, common as grief or going through a change in life, right, where you need some support, to something more serious mental illness, substance abuse and substance use disorders, for example, and lots of other things within there. So I think that piece around navigation, knowing that it's important to start somewhere. And often your health plan can be a resource for where to start. At UnitedHealthcare, we have supports for navigation. So you call that customer service number on the back of your card. We're going to help you get to the right door to get the support that you need, just as if you would if you had a physical illness, right? And, I'm having this symptom or this pain. Can you help me decide which specialist is the right one to go to for my concern? Do I need to go to, a physical therapist for this sore knee, or do I need to see an orthopedic surgeon, or can I start with someone else? Your primary care doctor is also an important place to start. I hope everyone has one. If you don't, it's a good reminder to get one, because when you have that long-standing relationship, they're going to help you navigate this, and often they can get you in quickly. An adolescent, for example, you might recognize that the first thing is that they've had a change in their academic performance at school, or that their relationships with their peers are changing. And if you're in a concern, your pediatrician is a great place to start to say, can you get my kid in this week? When you have that relationship, they're very likely to be able to do that. So calling that number on the back of your insurance card, reaching out to your primary care physician. And then I would be remiss if I didn't say, if you have an urgent need, if there's any concerns that there's risk of harm to yourself or someone else, you want to call a 24/7 crisis line and look into virtual care options, which can often get you in immediately within minutes and assist you very quickly.
And for some reason, I guess in popular imagination, the picture that people have of mental health treatment is very old fashioned, lying on a couch talking. Talk therapy is still part of the equation, but there are a palette of possible combinations of therapies nowadays that don't look anything like that ancient image that people still somehow have.
Yeah, we have many more types of behavioral health professionals, licensed mental health professionals in our nation than we've ever had before, right? And all of their trainings and degrees are not created equal, right? So navigation to that. The other thing is that there's significant differences can be sometimes a difference of fivefold of how many licensed mental health professionals are in the community where you live and work versus other places, right? So there are places in New England, for example, where there's a lot of schools that train mental health professionals, have a very high rate of people who are licensed to care for you in those states. There are some states in the Southeast, for example, that have a much lower number per capita of licensed mental health professionals. One of the things that's really helped us equal that out is telebehavioral health and telemedicine, because that can be practiced across state lines. And it's also a really good way to get your care in the privacy of your home. And we found that both members, patients, and healthcare professionals really like this modality of care, and we can help navigate to the particular thing that you need. Our goal in all of this is to avoid being in a crisis. The last place you want to end up if you're having a mental health care concern is the emergency room, right? For
Sure.
example, right? That's not a great place to get care. So avoiding that, getting care early, recognizing what we can also do with our behaviors for things like physical activity, the way that we eat, and how we take care of our broader physical health very much has a big impact on prioritizing our mental health as well.
I guess that gets us into the area of general well-being and its relation to mental health and taking ownership of it. And what are some of the best ways individuals can take that ownership of really their mental health, but their whole health?
Yeah, I think whole person care is that I'm glad that you brought it up. We know that individuals who have a chronic condition are more likely to have a behavioral health concern because they affect each other, right? And if you have a behavioral health concern that's the starting point, you might not be taking care of your preventative care or a chronic condition you have like diabetes. So absolutely one can impact the other. And that's another reason why having a primary care physician is so important, right? They're going to look into that broad comprehensiveness. Pediatricians, for example, are now routinely screening youth with just a couple simple questions around how they're feeling emotionally, recognizing that those milestones, can be challenging, and you want to diagnose and refer for that early. And it can really improve the quality of life. So, exploring those healthy behaviors, making those small incremental changes, and getting care early and having that longstanding relationship is really important to our overall well-being.
And I just wanted to touch on that idea of the delivery via the tele means. I imagine that must be a very important piece, especially of young people who are much more used to communicating by those means than, say, older adults who are just used to in person for everything related medical. So that must be a good way to get at those people that are at the younger generations, younger ages that need this type of health care. They can get it more easily and more comfortably for them by telemedicine.
Yeah, we saw telehealth utilization increase substantially following the pandemic. I would say it's one of the silver linings, is that, we have more access to telemedicine for both physical health and behavioral health. But for behavioral health, it went up thousands of percents from what it was pre-pandemic, and it stayed very high. Virtual visits can be easy to access. As I mentioned earlier, it can kind of equilibrate that there are some communities that just don't have as much access to in-person care for behavioral health, and licensed healthcare professionals can, in many circumstances, practice across state lines, and provide those supports. And you're not having to wait often, sometimes weeks or months to get an important appointment. I think the other thing, you mentioned the youth. Digital health, self-help tools can be important here as well. Sometimes it's, something simple like coaching, right, to get through a stressful situation. And it's good to model that behavior and think about the many different ways that you can get support. And starting somewhere, I think, is the best advice that I have. The youth, I'd love to spend a moment on too. We see from surveys that have been done, that we've been involved with, that adolescents are much more likely to speak with a peer than they are a parent or a teacher or an adult. So, having those conversations with your kids, if you have teenagers or children, if not your child, chances are your child is going to have a close friend who is going to confide in them that they have a mental health issue. And children think that they need to keep that private. And sometimes keeping it private is not the best for their friend's health, right? So coaching them on how to handle that delicately to still support their friend and pull in a trusted adult when it is beyond, just advice over, challenging typical adolescent issues, but when it's a more significant mental health, and they're not expected at their age to be the one who decides that, right? There's an adult in their life, whether it's at home or at school, who can help them navigate. So I think with the youth, that's incredibly important to recognize that if your child isn't prepared for how to go into that situation, they might be navigating it on their own.
Sure. And let's get to the matter at hand also that we have here, and that is we are into the federal employee health benefit plan open season, the annual event where people have hundreds of choices to make if they really delve into it deeply. Talk about UnitedHealthcare and what it's doing to support the feds branch of your service area as we enter this open season.
Yeah, the first order of business for us several years ago was to grow our network of mental health providers. We have more than 375,000 mental health care providers in our network, including almost 150,000 of them who provide that care virtually. So access to care many years ago was an important priority for UnitedHealthcare and Optum Behavioral Health. In addition to that, we recognized that the navigation support was incredibly important. Right. So when you call mental health care providers, different ones have different areas of expertise and how fast they're going to be available. So our care advocates can help guide you to the right care at the right time across that broad range of our network. And you'll get a personal experience to help eliminate that complexity and somebody to really hold your hand and help you find care timely. And then the third thing I'll mention is expanding the breadth of our solutions. What we've found is, more recently that we're seeing more and more people who have less acute conditions, stress, milder levels of anxiety, and they don't necessarily need to go see a psychiatrist, right, and sit on the couch and get a prescription. They may just need some support. So those digital self-help tools and coaching services. And last but not least, kind of expanding the breadth of some family engagements and supports. A good example is children who have eating disorders. Not common, but when we see it, it affects the whole family. So we have a family engagement center who will surround that entire family with the support that's needed in a circumstance like that.
Right. Yes, that's an important point. If you have someone in crisis in the family, in a sense, the whole family has a crisis on its hands.
Right.
And for more information, what are some good sources that people should go to?
We have all of this information and a lot more on our website. It's uhcfeds.com. And that has great information about the benefits that we offer to federal employees and their families to support physical health as well as mental, emotional, and behavioral health.
All right, some terrific information. Thanks so much for being with us. Dr. Rhonda Randall is the Executive Vice President and Chief Medical Officer at UnitedHealthcare Employer and Individual. And we wish you a good open season.
Thank you. Be well.
And I'm Tom Temin, and you're watching Federal News Network. Let's go back to the studio now for more on the Open Season Exchange.